Hello and welcome back to the Parkinson's Doctor, the YouTube channel where I share my insights and expertise on Parkinson's disease and related disorders. I am Dr. Ramon Rodriguez. I am a neurologist and movement disorder specialist at the Neurology One Clinic in Orlando, Florida. And in today's video, I have a very important topic to discuss with you. And these are the differences between Lewy body disease and Parkinson's disease. This is just a very hot topic, right? Because even among the movement disorders community, we believe that there is a gray zone between these two conditions. And today I will try to clarify and provide you with information that will help you understand a little bit better why your doctor might think that you have Lewy body disease and not Parkinson's disease, or the opposite, right? So the first thing that we need to be aware is that these are two conditions that affects millions of people around the world, but they are often confused or misdiagnosed, and knowing those differences between them can help you understand your symptoms better and get the right treatment and plan for the future. So let's get started, right? So Lewy body disease, also known as dementia with Lewy bodies, or DLB, that's the short for this, is a type of dementia that affects cognition, memory, behavior, and movement. And this is something I actually mentioned in the previous video where I was talking specifically about Lewy body disease. And I mentioned in that video that this condition is caused by the accumulation of an abnormal protein deposit called Lewy body disease. And Parkinson's disease is also a neurodegenerative disorder that affects movement, balance, speech, and other functions. So you see that a lot of the symptoms between these two conditions are quite similar. And probably 99% of the time, people that have Lewy body disease were initially diagnosed with Parkinson's disease. Now, Parkinson's disease, as we remember, is caused by the loss of dopamine-producing neurons in the brain. And both conditions are characterized by the presence of Lewy bodies in the brain, but they differ in the location and the extent of these deposits. And this is why these conditions are very similar. One of the main differences between dementia with Lewy body and Parkinson's disease is the timing and severity of the cognitive impairment. In dementia with Lewy bodies, the cognitive decline is an early and prominent feature of this condition, occurring typically within a year of the onset of the motor symptoms, the tremors, the stiffness, the trouble walking. However, in Parkinson's disease, the cognitive impairment initially is usually mild, and it is something that develops later in the course of the disease, most times several years after the onset of the motor symptoms. Another difference between Lewy body disease and Parkinson's disease is the presence and frequency of the hallucinations. And in people that have dementia with Lewy bodies, the visual hallucinations are very common and often occur early in the disease. And personally, I believe that people with Lewy body disease might have some sort of visual hallucinations or any other kind of hallucination, but most time visual hallucinations for me to even entertain the diagnosis. These hallucinations may be vivid, they can be quite complex and recurrent. Sometimes they see people that are quite pleasant, children playing, they can see animals, but sometimes these hallucinations can be quite threatening and they can be quite bothersome. In Parkinson's disease, the hallucinations are less common and usually occur later in the disease. So we're talking years after the diagnosis of Parkinson's disease. And frequently, when we talk about Parkinson's disease and the initial stages where they begin having hallucinations, they are typically triggered by medication or some other factors. Another difference between dementia with Lewy body and Parkinson's disease is the progression and the prognosis of this condition. In dementia with Lewy bodies, the disease progresses faster and has a shorter life expectancy than Parkinson's disease, unfortunately, with the average survival from diagnosis is about 6 to 10, 12 years for people that have dementia with Lewy body compared to 10 to 20 years for people that have Parkinson's disease, even longer for some people. We know people with Parkinson's disease that have been able to live with the condition for over 30 years, right? So this is one of the major differences between Parkinson's disease and Lewy body disease. In dementia with Lewy bodies, also the cognitive decline is more rapid and severe than in Parkinson's disease, and the motor symptoms are also more variable and unpredictable than in Parkinson's disease. In Parkinson's disease, the progression of the condition is slower and somewhat steadier compared to people that have dementia with Lewy bodies, and the motor symptoms in Parkinson's disease tends to be more responsive to medication compared to dementia with Lewy body. And this is something very important because many times we have patients coming to the clinic, and they come to the clinic because they feel that the medications are not working quite well for them, right? And they're saying, you know what, the condition is progressing, the medicine is not helping my mom or my dad, what might be going on? And then we sit down, we have the conversation, and I'm going to tell you something. Sometimes it even happens that it is during this conversation that we have multiple family members and the patient there. It is the first time that the family members learn that the patient actually has been suffering from hallucinations for quite some time. So the dynamic can be quite interesting. Now, the treatment for dementia with Lewy body and Parkinson's disease can be quite similar, but it is not identical. Both conditions require a multidisciplinary approach involving medications, non-pharmacological interventions, and I believe in those, physical therapy, occupational therapy, and so on, and supportive care. The main medication for both conditions is levodopa. Levodopa replaces the dopamine that is lost in the brain. However, levodopa may have different effects on dementia with Lewy body and Parkinson's disease patients. And the reason is that in dementia with Lewy bodies, levodopa may improve motor symptoms, but unfortunately, it may worsen the cognitive symptoms. They might cause confusion, or they might even worsen the hallucinations. So we have to be very careful. I believe that we should try it because if we can improve the person's balance and the mobility without affecting any other domain, I believe that there is value in that. However, we have to take it slow. We have to be very mindful about that and take our time, right? Begin with very low dosages and increase appropriately. In Parkinson's disease people, we know that levodopa may improve motor symptoms, and it's actually quite robust, right? It's quite impressive. Sometimes people feel like they're normal once again. However, with disease progression, some people might develop dyskinesia or involuntary movements, and this is something that we can discuss in another video. Now, the dose and timing of levodopa need to be carefully adjusted for each patient. Now, we always have to make sure that we're trying a good dose of the medication before we give up with them. Other medications that can be used for both conditions include dopamine agonists. However, the dementia with Lewy body population has to be very mindful. We have to be very careful because it can impair cognition. We can use anticholinergics to reduce tremor, mostly in people with Parkinson's disease. We can use amantadine to reduce dyskinesia. There are some other medicines, such as monoamine oxidase inhibitor. However, these medicines are much better options in people with Parkinson's disease, and they actually can have a detrimental effect in the community living with Lewy body disease. So once again, sometimes people come, they're trying all these medicines because things are not going well, and these medications might make things even worse, right? So what we have to do is slowly begin to remove all these medicines. Sometimes we see that the hallucinations, while they do not go away, they actually can improve, and the condition might get a little bit better as well. Now, remember that some of the medicines used for Parkinson's disease are used in dementia with Lewy body, but not all of them are really good candidates. And once again, dopamine agonists, anticholinergics, and amantadine, they're good options for people with Parkinson's, but I do not think that they are good options in the Lewy body disease community. For the cognitive symptoms, memory problems, some medications that are used for Alzheimer's disease may be helpful in the dementia with Lewy body patients. And here we're talking about cholinesterase inhibitors. So donepezil, rivastigmine, galantamine are good options. There is a medication called memantine, which blocks a chemical in the brain called glutamate that we can try it in the dementia with Lewy body population. We know that the options are very limited, right? So we just have to be very careful, and we have to be very observant and have this conversation with the caregivers and the patients to understand that some side effects might happen when they try these medicines. When we speak about behavioral symptoms, and you have to excuse me because I have a little bit of an allergy in my eyes, for the behavioral symptoms such as hallucinations or the agitation, so medications used for psychiatric disorders can be tried in the dementia with Lewy body community. We're talking particularly about antipsychotics, which block the effects of dopamine in the brain. And also we might need to use some antidepressants or mood stabilizers, which might help regulate serotonin and other brain chemicals, trying to improve the mood and their behavior. Once again, we have to be very careful because the Lewy body dementia population tends to be more sensitive compared to the people that have Parkinson's disease. For non-pharmacological interventions, both people with Lewy body disease and Parkinson's disease may benefit from physical therapy, occupational therapy, speech therapy, cognitive stimulation therapy. Cognitive exercises are very important in these communities. And these therapies aim to improve mobility, function, communication, and cognition through exercises and activities. And they also can help prevent complications such as fall or infection. So by doing this, we actually try to minimize the rate of complications in this community. When we speak about supportive care, both dementia with Lewy bodies and Parkinson's disease patients need regular follow-up with their neurologists and other health professionals to monitor their condition and adjust their treatment plan accordingly. And they also need education and counseling to cope with the challenges and changes that the disease brings. They may also need assistance and supervision from family members or caregivers to perform daily tasks. And they may also need social and emotional support from friends, relatives, or support groups to maintain their quality of life and well-being. So, as a quick summary, Lewy body disease and Parkinson's disease are two different but related conditions that affect the brain and the body. They have some common features, but also there are some differences in terms of the symptoms, progression, the treatment, and the prognosis that we need to understand so that we can plan ahead, right? And we can come up with a treatment plan for each person. If you or someone you know has been diagnosed with either condition, once again, it is important to seek medical attention and follow the recommended treatment plan. And it is also important to learn more about the disease and the management and to seek support from others who understand your situation better. Once again, thank you for watching this video, and I hope that you find this informative and helpful. Please subscribe to this channel for more videos on Parkinson's disease, Lewy body disease, and related conditions. And remember that there is an opportunity to make comments, and I will try to provide some feedback about them. And if I cannot provide a particular feedback, I actually will try to do a video talking about the comments that you're adding to the channel. So I am very thankful for that. Once again, I appreciate the subscription to the channel, and see you next time. Thank you.